Well, good afternoon, everyone, and welcome to this launch of the Review of Creative Health, initiated by the National Centre for Creative Health, the NCCH, and the All-Party Parliamentary Group on Arts, Health and Wellbeing. I'm Lord Howarth, and I shall be chairing the commission which will be undertaking the review. I'm extremely grateful to the very distinguished and busy people who have undertaken to be commissioners. If I share the screen, you can see the list of who they are. While you're absorbing those names, I'd like to invite our audience to say who they are in the chat. Please do interact with each other throughout the launch. We will be capturing the chat and may quote you, so be careful what you say. You will have an opportunity to ask questions later, and we would be grateful if you would post your questions in the Q&A box at the bottom of your screen and not in the chat. Please do also tweet about the event using the hashtag #CreativeHealthReview. First of all, though, what is creative health? The term creative health refers to non-clinical approaches which, through engaging individual creativity, can significantly benefit well-being and health. Creative health involves engagement of the imagination with arts, culture, and the natural world through activities such as singing, drawing, painting, photography, dancing, craft, creative writing, shared reading, as well as involvement with the heritage, and with everyday activities that can be creative, like walking, gardening, and cooking. These health-giving activities can be encouraged through social prescribing. The benefits of creative health can also be important in hospital, social care, and end-of-life settings. Many excellent practitioners have, of course, been applying this approach for years past, and it is, in a way, ancient wisdom. There is an increasing evidence base showing measurable and cost-effective benefits to personal and public health from such creative interventions as part of a health and preventative approach. We believe that creative health has an important part to play in supporting the NHS and social care, particularly as part of personalised care. This approach has been recognised in the NHS long-term plan and with the establishment of the National Academy for Social Prescribing. Some of the new integrated care systems are embracing creative health, and NCCH is working with them. The value of creative health is also recognised by the Department for Digital Culture, Media and Sport, as well as by Arts Council England. The publicly funded research councils have begun to invest in this field. Why then do we need a review and a commission? The answer is because creative health still has only a toehold on policy and practice. We believe it has much more to give and needs more impetus. Creative health can complement and support the prodigious achievements of modern medicine and the NHS. It can take some of the pressure off GPs. It's thought that maybe 20% of GP appointments are sought by people who do not have a clinical condition, but have emotional or social needs. Where social prescribing has been used, studies have shown reductions in the order of 28% in requests for GP consultations and 24% in A&E admissions. The evidence also shows that hospital patients can benefit from creative health, requiring less treatment with drugs and recovering more quickly. Very importantly, too, creative health activities can ease stress and burnout among medical and care staff. So, creative health, properly resourced, can keep people healthier for longer and relieve pressures on the NHS. If creative health approaches are widely adopted, there would be large benefits for health and a significant release of NHS resources for other much-needed purposes, leading to better value for the health budget. When we look at the crisis in funding a health system whose rising costs constantly outstrip the growth of our economy, we know that preventative strategies need to be central to policy. Focusing more on wellness as well as illness, we must harness creative health to help us become a healthy and health-creating society. Going beyond these immediate benefits to the very hard-pressed health and social care systems, we believe that creative health activities embodying kindness, neighborliness, and local solidarity can help forge stronger bonds in society. Shared creative activities can mitigate loneliness, strengthen mutuality, and develop community resilience. In these ways, creative health can help reduce health inequalities, level up, and improve productivity, crucial challenges for government and all of us. Faced with so many and such intense economic and social anxieties, as well as the crisis in healthcare, this is a time for all of us to consider new approaches and discuss our values and priorities. The output of the review in a year's time will be a set of recommendations to government, not just the Department of Health and Social Care and DCMS, as to how it can develop a cross-governmental strategy for creative health. So that's what the review is about. Now let me tell you how the review will proceed and how you can be involved. Central to the review will be a series of thematic roundtables at regular intervals from this autumn until the spring of next year. The roundtables will address key policy areas where creative health has an important role to play and how we can maximize its potential. The roundtables will present the most up-to-date evidence and research and showcase creative health approaches and activities that are having demonstrable impacts on health and well-being. The first roundtable is coming up soon, October the 27th, and will be on the theme mental health and well-being across the life course. Each roundtable will feature a panel of expert speakers, including people who have benefited from creative health, and will be in an online webinar format open to a public audience. You can find more details of the roundtables and how to join on the NCCH website, the link to which has been provided in the chat. The findings from the roundtables will inform our commissioners, and they will be asked to develop the recommendations to government based on what they have heard. Additionally, we want to incorporate contributions from you, the public, practitioners, policymakers, researchers, and others involved with creative health. An open call for contributions will run throughout the duration of the review. More information about how you can get involved by submitting your own evidence and experiences is also on the NCCH website. Our findings will be made available throughout the process. Keep an eye on the website for these. Now, to tell us more about the personal impact that creative health can have and the importance of lived experience and personal stories, I'd like to welcome one of our NCCH trustees, the lead peer support development coordinator at the South West Yorkshire Partnership NHS Foundation Trust, Debs Teal. Debs.
Thank you. Well, my story started way back in childhood when I first entered what wasn't really a mental health system back then. It was just a GP. And I saw the GP and it was described as bad nerves, which we would all today say would be a panic attack. And I've been in and out of the mental health system from that age up until 12 years ago when I reached crisis point, and I was told by the psychiatrist that I would always be ill, I would always be medicated, and I would never work again. At that point in time, I was on 21 tablets a day. I was often bedbound because of the side effects of the medication and the illnesses. I'd been medically retired from my last job and my children were my carers. So I believed everything the psychiatrist told me. He had the answer to my problems. He knew what he was talking about. He was the expert. And I ended up taking an overdose because I felt that I'd been given a terminal life sentence, which I didn't particularly want to live with. I woke up in hospital opposite a lady who was dying of cancer. She had a wonderful palliative care plan in place. She had all this support and network around her. And I felt I was in the same position as her, and I had nothing. I had nothing but more medication, more counselling, more of the same. And even then, it wasn't ever going to get better. Part of being discharged from the hospital was that I was referred to psychology. Whilst I was in the waiting room for the assessment, I saw a leaflet, Creative Minds, Art for Wellbeing. Never done art before. I don't know why I picked the leaflet up, but I picked the leaflet up. I took it in with me, and they said, just give them a ring. The art class was literally 5-10 minutes from my house. It was so close to home. It was so accessible. I went along, and that's the day my life changed. And in the last 10 years, I've been off all medication for nearly 10 years now. I've been out of services for 7.5, and I work in the same NHS trust as that expert who told me that I'd never work again for. I started doing talks initially to service users because I felt that I'd been offered no hope, no aspirations in the system, that nothing was ever going to get better for me. And I wanted people to see that things could get better given the right support and the right way of working. Then the experts started asking if I'd do talks at their events. So I've done talks, thousands of talks up and down the country, several abroad, including one for the World Health Organization in Helsinki. I've sold 168 paintings, not bad for somebody who can't draw. I've had an exhibition at Canary Wharf in London. Last year I had a piece of artwork in the United Nations International Art Exhibition. Now, I talk really passionately about people with lived experience being involved in things like this. And, you know, I absolutely thank the NCCH for involving me right from the very beginning. I was there at the launch of the original report. I'm a trustee now, and it's so valuable to have my insights on what helps people like me. A lot of people I work with and who I deal with think the arts are only for people who are rich. They're only, you know, it's so unachievable to talk about arts in some of the networks and areas that I work in. And I say to them, do you think I'm rich? And that sort of quashes their idea of what they think the arts is for. But it's about making it accessible, and it's about making sure that that voice is heard. The NCCH have the Lived Experience Network. They also have Creative Health Champions. So it's embedded in all what we do within the NCCH. And that's really powerful to me, that voice is heard, because sometimes I hear, see and respond differently. And a few times when we've been at a trustee meeting and I've gone against what other people have said because it's not been right, and they've agreed, they've accepted what I've said and taken on board what I've said, which is really valuable. And that's why it's so important, because we want to get this right. Yes, we do. We want to make sure it's right for every single person, for everybody, because to us, everybody counts, everybody matters, and we all need to be able to access what we want. You can see some of the artwork behind me, and people say to me, what was it about art that worked when traditional services? I've been in it 40 years, so I've had lots of other services involved. And art allowed my brain to stop. It allowed the racing track brain that is all I'd ever known to stop and allow me to have that time to heal myself. And if we can do that for other people, if we can allow them to have the time and energy to think for themselves, we must do that. It's our duty to do that. Thank you for listening. You're on mute, Alan.
Sorry about that. We thank you, Debs. That was eloquent, powerful, moving, inspiring. Thank you so, so much. I'd now like to introduce you to one of our commissioners, Baroness Young of Hornsey, Lola Young. Lola is an independent crossbench member of the House of Lords. She's a former actor, professor of cultural studies, head of culture at the Greater London Authority, chaired the Caine Prize for African Writing, the Orange Prize for Women's Fiction, and the Man Booker Prize. And I think, Lola, you're also chairing the Local Government Association Cultural Commission. So it's great that you're going to be one of our commissioners. Lola.
Thanks very much, Alan. I always forget that I used to act. It's really interesting what Debs was saying, because she reminded us that the arts still have an image problem. Because I think those of us who've worked in the sector for many years, trying to dispel some of the myths around arts and culture, trying to make it plain that it is really for everybody and needs to be inclusive, diverse, and all of those other terms. We've gone so far, but not quite far enough. But it's really interesting to me, because when you actually talk to people like Debs and other people who've had those personal experiences, it does bring it home to you. And as you said, Alan, you're quite right. I've been chairing the LGA, the Local Government Association's Commission on Culture. And that's been a very, very interesting and very positive experience. And in fact, our methodology has been very similar to what we're going to do, in as much as we've got a whole bunch of really expert commissioners from around the country, from different art forms, from local authorities, individuals and organisations, taking in evidence from around the country, looking through this lens of place, thinking about how we feel about our local areas. And of course, that's really important when we're engaging with local authorities, who, by the way, contributes so much in terms of funding to our arts and cultural life. A really important stakeholder in all of that. And I hope there's a way in which we can make sure that we keep those links going when we're carrying on with our work over the coming year. So, as I say, we've had a very strong focus on place, and that's fed into ideas about identity. And inevitably, during the pandemic, with the lockdowns and so on, that idea of place has come under, you might say, tension, as people have been confined to particular areas. And maybe there's a challenge here, I think, post-pandemic, but not quite post-pandemic, in the aftermath of the first wave of the pandemic, let's say, that we can think about how we can address some of those inequalities, particularly around health and particularly around mental health, in my view, for young people, because we've heard again and again that young people in particular have had a really, really difficult, challenging time, to say the least, over the past couple of years. Our report will be due out in December, and as I sort of suggested, we covered a lot of ground around the creative sector, and I think, again, there'll be a very productive and positive overlap with some of the work that we'll be doing over the coming year, which will be around job creation, it will be around the economics of the creative industries, it's around the kind of personal testimony that Debs is such a great example of. So I think those are areas there, again, where we can sort of tie up with that work. We have a huge mix of experience, knowledge and commitment on this panel. And whilst I do think that what we're trying to engage with is very challenging, because it's so complex, whether you're talking about the content, whether you're talking about our aspirations, or whether you're talking about the analysis of what we want to do and how it can be done. It's all very complicated, it's complex. There'll be difficulties politically, I envisage, but nonetheless, I do think with the panel that we've got, with the already existing evidence and more to come, we'll be able to rise to that challenge. So that's me.
Wonderful, Lola. And with the benefit of your passion, your experience, and in particular, perhaps the work that you've been doing leading the LGA Cultural Commission, we will be off to a flying start. I'd now like to introduce James Sanderson, another commissioner. James is Director of Community Health and Personalised Care at NHS England, leading on a range of programmes supporting people to have greater choice and control over their health and well-being. James.
Hello. So why is creative health important to the NHS? Well, a number of facts for you. So 1 in 5 GP visits are purely non-medical need. People are visiting the GP now for issues of loneliness, social isolation, perhaps debt, perhaps relationships, perhaps issues with housing. We also know that whilst medicines and drugs are fantastic in treating many diseases or issues, we know that there's an over-reliance on medication. The chief pharmacist's review at the beginning of this year found that 1 in 5 people over the age of 65 are in hospital, not because of the condition that they're living with, but because of the drugs that they're taking. So that's why the NHS has embraced social prescribing and personalised care. We know that in order to support people in the most effective way, a one-size-fits-all approach to health and care is not what's needed. We need to ensure that we're giving people choice and control over the way their care is planned and delivered based on what matters to them and building on the assets that they bring to their own care. And within that, social prescribing has become a real plank of NHS future strategy. We put into the long-term plan for the NHS back in 2019 the rollout of social prescribing as a universal mechanism across primary care, where we'd have link workers embedded in primary care that would work actively with those people turning up to general practice with a non-medical need in order to connect them effectively with their communities. And within this, creative health plays a huge part. So across the country, there's a myriad of responses from arts organisations, from voluntary community faith, social enterprise organisations who are supporting people to live their best life by developing innovative strategies in the community. This could mean dancing for falls prevention. It could mean singing for lung health. It could mean taking part in an art class to support people's mental health and well-being. And we know that the creative support that people provide is well evidenced of having fantastic outcomes for people in improving their quality of life. So creative health is really important within a model of personalised care. The NHS has a huge number of people out there through professions, through art therapists, through allied health professionals that are supporting people on a day-to-day basis. And the fantastic link workers across the country are connecting people to arts-based activities every day of the week. And what we want to see is this really embedded as part of a wider community programme of support for people so that we can provide care and support close to home in innovative ways, embracing the immense power of the arts and creativity. Thank you.
Simply emphasise how very welcome it is to have you as a commissioner. And you were, of course, until very recently, the Chief Executive Officer, the first Chief Executive Officer, founder, CEO of the National Academy for Social Prescribing. So again, you bring a great wealth of practical knowledge and experience, as well as the commitment that you have in your present role at NHS England. So thank you. I'll now turn to Monty Don. As everybody knows, the UK's leading garden writer and broadcaster, lead presenter of the Gardener's World for some years past, a prolific horticultural journalist, author of numerous books. It's wonderful to have you on this commission, Monty. We're extremely grateful to you for joining and look forward to hearing what you have to say. You're muted, I think.
Now can you hear me? Are you hearing me loud and clear? Hello. I was saying that I feel a little bit of an outlier amongst such sort of assembled expertise, but the more I think about it, if I take myself seriously in my approach to my world and health, both my horticultural world, my cultural world, and the world of the health of myself and my family, I actually think it's central. I think it's really, really significant and important. Now, as a gardener, I do my best to grow healthy plants. And that sort of is a statement of the bleeding obvious. But I do it by making sure that the horticultural health of my garden is integrated with that of the wildlife, the individual plants, and really significantly, the health of myself and my family. In other words, you cannot separate natural health, the health of the natural world, and human health at all. And that seems to me something that as a culture, we have separated, we have forgotten, we do not respect and heed as much as we could or should. So that's that from a starting point. That's something that I would be very interested in discussing, how we can change that, what we need to do, whether it's nudging, whether it's pushing, whether it's enforcing, whether it's a lack of money or whatever. And there is also the fascinating element that we're discovering more and more about is the relationship, for example, between our gut biome and the bacteria in the soil. The food that we eat directly affects our physical and our mental health. And that is something that is completely fascinating and connects to every single person, whether they have a window box, some chili seeds on a bedsit window, or whether they have an allotment or a garden that is acres big. So you're connecting with people. And one of the things that I do in my line of work is, and that gets me up in the morning, is that you're reaching people. You're talking to people at home in their domestic lives, their private lives. And I receive a lot of letters, as I'm sure we all do, and connect with people who are muddled and confused and sad and struggling in lots and lots of ways, as we all do and all have done, but find joy, relief, inspiration, and in the broadest sense of the term, health in their garden. And so it funnels back into humanity and humanity connecting with nature. And we know that the action of growing something is empowering. It's hugely empowering, and empowerment is part of health. And it provides hope. And hope is part of health in any definition of the word. And this connection to the rhythm of the seasons. I often get contact from people who've had losses or sufferings that say that gardening with connection to next spring, next summer, is enormously important in bringing them through dark periods. And one of the things that I know through my own mental health and those in my family, it's actually quite important to know that things are going to get worse and then get better again. That the seasons can teach you that. It's not just about getting better and better and better and growing and growing and growing. You have to, of coping, adapting. A healthy garden is one that adapts to the conditions it finds itself in. And healthy people do that too. Learning to cope and to be empowered to do that. Now, on a practical level, does that mean we need to think about the education of children at school? Should every school have a garden? Should we be providing more allotments? Where's the money going to come from that? How does it relate to planning? The community gardens, there's really good work going on right across the country with community gardens of all kinds, of integrating different social groups. That's a kind of health. It's maybe nothing to do with horticulture, but just getting people from different backgrounds in the same place, doing the same activity, is enormously important and empowering. And to what extent that needs government intervention, to what extent it simply is a question of communication, that we're just not getting the right message out, and there are maybe very, very simple ways of doing that. So I'm extremely interested in both listening and learning and maybe contributing a little bit towards that end. My real interest, I have to say, is with mental health rather than physical health. And it's something it is sort of central to my life and is very important. So I do feel that if we can encourage everybody to take seriously the role of the natural world and maybe engaging with it directly, not necessarily through gardening, but through walking or whatever it might be, as part of our mental well-being, it is profoundly important, because the mental health setup in this country is, through my own direct experience and my family, at best potluck and at worst utterly disastrously chaotic. And that must change. We have to change that. And so all those things I'm extremely eager to contribute to, and thankful for the opportunity to do so. And just know that our own human health is inextricably combined with the health of the natural world. And we can never separate those two things. And if we can somehow take that seriously and finance it, encourage it, inspire it, then for me, that would be a success.
Well, thank you, Monty, for those very profound thoughts. And in particular, I think that thought which you reiterated about the inextricable relationship between the health of the natural world and the health of the individual and society. Now, I turn now to Darren Henley, another commissioner, Chief Executive of Arts Council England, with very wide-ranging and relevant experience across the arts, media, education, charity, government. the author of 2 government reviews into music education and cultural education. And for a long time, Darren, you've been a strong supporter of the arts and health concept. Darren.
Thank you, Lord Howarth. Well, at the Arts Council, as you say, we've long recognised the contribution of creativity and culture to the well-being and health of everyone, wherever they live and whatever their background. And I think the pandemic may have provided a catalyst for new projects and programmes in this field. But as you say, our work in this area has been going on for quite some time before COVID-19 cast its shadow across so many aspects of our lives. Back in 2008, we published our joint compact with NHS England, and that laid out the vital role that creativity and culture can play in supporting the well-being of every community and to public health in general. In the following years, we've continued to explore that territory, including our close collaboration since 2013 with the Bearing Foundation, and most recently that was on the programme Celebrating Age. And that saw around 64,000 older people become creators, artists and curators with really demonstrable improvements to their well-being. Around 200 arts organisations, health and social care providers were involved in that. Many of them formed new partnerships to collaborate on projects. We were really proud to be a partner on the Arts, Health and Wellbeing APPG report on creative health back in 2017. And I think that remains a beacon for practitioners and policymakers alike in this field. And we're really pleased now to continue to be working closely with the National Centre for Creative Health, whose creation was a direct result of that report. In Let's Create, which is our Arts Council England strategy for 2020 to 2030, we set out a vision for a country that's transformed by culture and creativity, and in which people live happier, healthier lives. And I'm particularly personally keen to talk about happiness. It's something that I believe very much public policy is all about happiness. I think that, if you ever commute to work, you wonder if the people who designed our transport system had happiness of their consumers at the heart of what they do. And I think in so much of what we can do, happiness is a higher goal, and we should never be ashamed to talk about that. Some people feel it's a weak word. I think it's a very strong word in life. And by creative health and well-being, we mean the connection between creativity and the health and quality of people's lives. And we believe that creativity and cultural activity should be reviewed by society as an absolutely fundamental part of living your life well. And earlier this year, we commissioned UCL's Social Biobehavioural Research Group to investigate the impacts of creativity and culture on the brain. And their report, which I really recommend to you, offers extensive evidence that engaging in creativity and culture is linked to positive well-being, feeling connected, and motivation in people across a wide range of different ages and locations. And at the heart of our work is social prescribing. And at the Arts Council, we've already formed a partnership with the National Academy for Social Prescribing, which has proven to be a fantastic organisation. And this forms for us the backbone of the relationship that we have with the NHS. And when Thriving Communities, the programme that they run, was launched, the challenge of COVID-19 meant that issues such as loneliness, anxiety and social exclusion were being felt even more acutely by many people living in all parts of the country. And the 36 projects that formed that programme helped to address those issues at the heart of communities, and many of those communities are based in areas of high deprivation. More than 10,000 people took part in activities that ranged from canoeing to crochet, from photography to paddleboarding, from sport to spotting wildlife. And the participants included young carers, included armed forces veterans, those who'd been recently bereaved, and those who had long COVID. And there were almost 4,000 sessions, and they were held outdoors, indoors, or virtually, from places from Plymouth to Peterborough, from Sunderland to Southampton. And there's growing evidence that taking part in creative and cultural activities really can improve our physical and mental health. And that's why creative health and wellbeing is absolutely part of the lifeblood of our delivery plan for our 10-year strategy, Let's Create. It's why we're working in partnership with those in the culture and creative sector and the health sector to do that. And I think that this will help us deliver our ambition of transforming the country through culture, making us all happier and healthier. So for me, creative health and wellbeing, I believe, is just what the doctor ordered.
Well, thank you, Darren. We hugely appreciate your willingness to give your own time to this commission. And it's great that the Arts Council has made the commitment that it has, and we will have the heft of the Arts Council supporting us in this process. I'd like to welcome Tracy Brabin, who has just arrived. We knew that you wouldn't be able to get here till 3:30. Wonderful to see you, Tracy. As everybody knows, Tracy is the first mayor of West Yorkshire, the first ever woman Metro mayor. And you pledged in your campaign, in your mayoral campaign, to lead a creative new deal for your region. Before you became mayor, you were member of Parliament for Batley and Spen and Shadow Secretary of State for Culture. Equally important, I think, you were an officer of the All-Party Parliamentary Group on Arts, Health and Wellbeing. So it's wonderful to have you in the fold. I know that you very kindly said you're going to respond at the end of the Q&A session. So I'll now hand over to Alex Coulter, the Director of the National Centre for Creative Health, and Alex is going to chair a question and answer session.
Thank you, Alan, and thank you, everyone. I'm going to ask some questions, first of all, to some of our commissioners who haven't yet had a chance to speak. And one of those is in the box here from Asma, and it's for Rob Webster. So Rob, Asma says, I'm a commissioner at Warwickshire County Council and I lead on a suite of creative health programmes across the life course. What do you think are the key opportunities for creative health as integrated care systems are established?
Great. Hello, everybody. My name is Rob. Can I just check that you can hear me okay? Great stuff. So I'm the Chief Executive of the West Yorkshire Integrated Care Board, which sounds like a bit of jargon. What it means is that the NHS, councils, communities, third sector organisations work together to improve outcomes for local people. And to answer the question, if you look at integrated care partnerships and the systems that we work in, they're trying to address two things. Firstly, that the things that cause ill health have nothing to do with the NHS and everything to do with the wider determinants of, what sort of house you live in, whether you have access to green space, what your education's like, do you have a job, etc. Or put simply, having somewhere to live, someone to love and something to do. And if we're working together with councils, third sector organisations, we can look at those wider determinants together to create the kind of society and interventions that will make a difference to people and keep them well and their well-being in the right place. And to come back to some of the things we heard earlier, let's remind ourselves that the pandemic has driven a 52% increase in the number of referrals of children into specialist mental health services. So the wider environment that we operate in is causing people to become unwell. So we have to do everything we can to keep people well. So if that's the first thing we're trying to do as partnerships, the second is then to make sure that we know that you need access to good care and treatment, and the care and treatment needs to be effective for you. And you've heard from Debs that sometimes you need something different. Sometimes you need a mixture of the medical, sometimes the social, sometimes the mental support that's required. So our systems really are designed to meet the mental, physical and social needs of people. So on both of those jobs, having access to creativity and creative health helps, because meaningful activity keeps you well. We're called human beings, aren't we? We're not called human doings. It's this sense of being, this sense of self, this sense of purpose, this sense of meaning, as Viktor Frankl would have it, that's really important. So having access to that keeps you well. And if you're not well, then it can help you to become better. So what I would urge anybody to do who's working in commissioning is to work with their integrated care partnership and their integrated care board to say that we already provide here and have connections to things that can help, either because you can socially prescribe them, if you want to use that language. Your GP can say the best thing for you at this point is to do some gardening with some people, to do some painting, to go on a dance class, do some photography, whatever it is. Or you've got some capacity which will help in the general well-being and sustainability of your local community. So there are huge opportunities for integrated care partnerships and integrated care boards, because once you get beyond the jargon, unless we focus on the prevention agenda, and unless we target the right kind of support for people, we will not be able to deliver good and effective care.
Thank you very much, Rob. And that I'll segue into Martin Marshall, Professor Martin Marshall, who's chair of the Royal College of GPs. Rob mentioned the role of GPs in this, and there's a question for you, Martin, from Nicola Gill. She says, I'm a GP educator and run creative health seminars for GPs across Yorkshire and the Humber. What can we do to ensure other areas of the country include creative health in the GP training curriculum and the continuing professional development of the primary care workforce?
Yeah, thank you very much indeed, Alex. It's a real pleasure and a real privilege to be part of this group. I know from today's conversation I'm going to learn an enormous amount, and I hope I've got something to contribute as well. So I'm going to come at your question from a GP perspective, and from my perspective as a clinician working as a GP in East London in Newham, creative health is a set of interventions which are complementary to, and at times alternative to, what we're trained to do as doctors, which is provide traditional medical interventions. It's really important, and I'm seeing a growing number of clinicians around me engaging with this for three reasons, which I think other speakers have discussed. First one, we know it works, so there's good scientific evidence it works, and I think we shouldn't dismiss scientific evidence because clinicians are brought up to a scientific way of thinking. So having the evidence is important, and Alan described that evidence really clearly. The second reason, which Deb described beautifully, is patients want it. They want alternatives to traditional interventions that we tend to provide as GPs. And then the third reason is actually clinicians are increasingly frustrated with the medical model. You know, they can see that a lot of the interventions that we were taught to provide really aren't that impactful, really don't work that well. So I think, you know, Monty described beautifully in such an elegant fashion the benefits of gardening as a creative intervention, and I think a growing number of clinicians can see that, and as others have described, the sense that we are over medicalizing problems is very strong. So what's our role? Well, first of all, I think it's really important that GPs aren't the entry point to all creative health support. That would be a disaster, particularly at a time when general practice is so busy. There has to be many ways in, but actually GPs do play an important role. So the vast majority of patients are registered with a GP in the UK. We see about 65% of our patients in any 12-month period and 95% of them within a 36-month period. So we've got great access. And most importantly, once we've got that access, our patients trust us. So, you know, I'm looking after a patient in my East London practice who's obese. He's got really poorly controlled diabetes. His expectation was I was just going to dump more and more medication on him and try and control his diabetes. And instead, I suggested that he go to a cooking on prescription course with his wife and that he registers for an exercise on prescription course. And I remember he said to me about 2 months down the line after I made these suggestions, I never would have done those stupid things if I hadn't trusted you and if you hadn't said that it might be a good idea. So there's something about the trust that patients have in us as GPs, which I think is really important. So back to your question, what's our role as a college in promoting creative interventions? Well, first of all, I think we have to recognize that what we're asking for here from clinicians is a very significant culture change. This isn't just a change of behaviors. This is a real culture change in the way that we think about health. And I'm sensing clinicians are engaging with that. I think training, particularly of the next generation, is really important. So we're putting this into our curriculum. We're going to be examining against it. We're going to be encouraging the future generation of GPs to be really engaged with this, as engaged as they are with traditional medical interventions. So that's one thing that we are doing and we must continue doing. The second thing we can do is shine a light on good practice. And there's so many examples of creative interventions being used by health systems, by general practices in particular around the country. And our job as a national organisation is to shine a light on them, to present case studies, to demonstrate to others how effective they can be. And then the third thing linked to that is providing educational programmes. All of us as clinicians are committed to continuing professional development, and our job as a professional body is to provide education and training courses, which we do very much focused in this territory. So I think there's a whole range of things that we can and must do as GPs individually within our practices, within our communities and our localities, but also nationally as well. So Alex, I hope that's helpful.
That's brilliant. Thank you very much, Martin. I'm going to take us outside the NHS. We've obviously been in NHS world, and I have a question for Madeline Bunting, who is an author and journalist. Madeline, Douglas Noble says, I've been very involved in working with residents and staff to bring live music into care homes over many years for Live Music Now, and see how music and creativity support relationships as a foundation of meaningful person-centered care. From your research for your book, Labours of Love, what do you think is the main barrier to greater recognition of the importance of relationships and valuing creative approaches in care settings?
It's a very good question, and I suspect we all know the answer. It's a very, very simple answer, which is that the social care system is in crisis. In August, it was reported that staff shortages had jumped by 52% just in the last year. So there's 163 or so vacancies in the social care system. It's very hard for a system that's in crisis to engage in a creative way. There's been some very interesting work. I'm not very knowledgeable about neuroscience, but very interesting work about how creativity and compassion are very linked to one part of the brain, and competition and threat will inhibit that creativity and that compassion. And in care, that's a really, really crucial issue. I hope for the scientists present, I've managed to roughly paraphrase it. But I think that this is really relevant in the care system. If you have a system where people are really anxious about just meeting the basic needs of clients, which we understand and believe to, in many cases, not to being met, people left in their rooms for hours, for days at a time, vulnerable elderly people. So although I'm hugely inspired by the wonderful chat, I can hardly keep up with all the wonderful projects all over the country, and many times dementia is coming up as a key issue, and I'm as aware as anybody of the enormous benefits of creative projects for people suffering from dementia. There is a real question here about the review about how we are operating in tough crosswinds, that we have a real funding shortfall in terms of the care system, and there does not at the moment seem to be the political engagement with how to resolve that. So it means that creativity just drops off the agenda in too many organizations and institutions who are frantically just trying to meet the bare minimum. This is a deeply distressing issue, I think.
Thank you, Madeline. And that also takes me to my next question. Dame Caroline Dinenage, who is an MP and former minister in more than 2 government departments, I think, but including the Department of Health and Social Care and the Department of Digital, Culture, Media and Sport. So just following on from what Madeline was saying, Caroline, what do you think, from your experience in government, why do you think creative health is important, and what can we do to progress that agenda with government?
Hello, everybody. Yeah, I mean, I'm totally sold on this. I was sold on it as you say, I sort of bounced around various different government departments for about 6 or 7 years, and so and kind of brought passions with me from one department to the next. I was responsible for social prescribing and personal health budgets and various other things in the Department of Health, which is where I met the amazing Debs, and I've been a bit of a political stalker of hers ever since, and then went on to the Department of Digital, Culture, Media and Sport, and very much wanted to take some of the learning of the Department of Health with me, which is why I got involved with lots of things like singing for dementia. The big challenge we have, and I think somebody alluded to it already, is the fact that government departments work in silos. Government departments don't only work in silos between the departments, they actually work in silos within the departments. So the big challenge we have is breaking down those silos and getting different bits of government to communicate with each other and work collaboratively. And the way that you do that is by having really strong voices from within government, which is why this panel is useful, but also having really strong evidence as to what works and how we've gathered together the power to show how this stuff changes lives. And I've seen it in my own constituency. Every single member of parliament can see an example in their own constituency. The one I really often use in my own constituency is my men's shed, which is like, I always describe it as like a WI on steroids for men, in an area like mine, which We've got a lot of guys who used to be in the armed forces, particularly the Royal Navy, and they're used to that comradeship and camaraderie, and suddenly they're out of the other end of that. And loneliness, we know, costs the NHS more than smoking. This is a group in my patch, 160 members. They come together, and so much of what they do is creative. It's things like, well, I mean, I call it a train set. They don't like that. They call it a model railway. They have a ukulele band. There's all sorts of real creative enterprises that they get involved in, but they do it together. It's collective, it's community, it's camaraderie, it's comradeship, it's love, it's support. And more than one of them has told me that they felt that that group has literally saved their lives. The more we can get members of Parliament and members of the House of Lords and other influencers into those settings in our own community, so that they're championing them and championing how this stuff works, and making the link between the medical and the creative and the community and the long-term benefits, and seeing that this is actually that there's government policy at the very heart of this. This isn't just a sort of really nice little thing that's happening in my local area. Then we have some really strong advocates, and that's what we all need to achieve.
Thank you, Caroline. And that takes me nicely to a question which I'll put to Tracy, which is specifically about that. I work with health and cultural providers across South East London. Do you have practical examples of how we can best engage our MPs in supporting our work and taking an interest in the creative health agenda?
Well, it's a really good question, and hello everybody, and I'm completely inspired, like others, of the phenomenal number of organisations that are in the chat, and it's good to have heard the presentation so far. I think MPs have a really privileged position in that they see the organisations that are across the whole of their constituency. So, you know, the GP surgeries has been alluded to. It can be quite a micro aspect of the local area, but we get to see the entire patch, and therefore, we can champion many of the causes that are out there, many of the organisations and the groups that are out there. Now, Caroline and I are complete champions of this course, of this research and everything about it. And we've got our own personal experiences. We've got our ministerial experiences. I was lucky enough to be the world's first minister for loneliness. And, and as a consequence of that, I saw the work of social prescribing. It was very much a central part of the loneliness strategy, which did go across all the departments to try and reduce some of that silo mentality that Caroline made reference to. But, ministers come and go and things happen and everything else. But MPs slightly have, often have a longer lifespan. And therefore, making sure that MPs are aware of all of the different things that are happening in their constituency is the first part. We can then visit it, we can then highlight it, we can champion it, like Caroline says about men's sheds, and we can do other things that are really, I think, innovative. So myself, I have a freshers fair for older people, is what I call it, and we have like 70 stands that include statutory organisations, but they also include things like the choir and arts groups and walking netball, and connect people back into those community groups. I think it's really important, why we do have a disconnect in central government around wellbeing, that all these brilliant projects continue, and that they are because we don't have a strategy that prevents illness. We don't have a strategy that promotes wellness. Therefore, what we actually need to do is make sure that everything that is being done in our constituencies, and don't forget there are 650 of them, is being made aware. We are being made aware, and we're being made aware of the importance and the value to that. So keep doing what you're doing is basically what I'm saying. Keep championing it. Keep making sure that if you see your own MP talk about your initiative, they may be more receptive than you realise. My own allotment saw me through my cancer treatment. It saw my other half through his mental health struggles. We now give half our allotment to the local schools so that they too can support children with mental health challenges. So you never quite know what your own MP is going to end up championing. Just ask them the question, tell them what you're doing, and get them along to visit your projects.
Brilliant. Thank you, Tracy. And thank you, all of you. I'm not going to ask any more questions. We have got quite a few more questions in the Q&A box, and we can stay on afterwards to discuss any of the practical issues around the review. And we'll try and answer questions by email if we can. But I'm going to hand over to Tracy now, who Alan introduced at the beginning. So thanks.
Thank you so much, Alex. And Tracy and I used to enjoy the fact that there were two Tracys now in Parliament, which is not the name of MPs you would normally think of many decades ago. And great to see so many friends and colleagues, ex-colleagues on this call. And to Lord Howarth's point, when I was a Member of Parliament, as an ex-creative myself, after 3 decades as an actor and a writer, I understood the power of this sector. And as the Mayor of West Yorkshire, I'm now in a very, very privileged position that having responsibilities over housing, transport, skills, adult education budget, policing and crime, culture, and so on and so on. I'm in a brilliant position to be able to lead the way and to get on and not wait for permission from others, but just to see it as a priority for a number of reasons. As Rob, who I work very closely with, Rob Webster, somewhere to live, someone to love, and something to do. I mean, if that is not the most simple strapline for everything that we're hoping to do to build resilience and hope and happiness in our communities. So I've been able to set up a culture and sport committee with a substantial budget, £11.5 million. A big chunk of that is going to go to social prescribing. But it's not just what we can do within West Yorkshire on our own. We are in a very, very unique time in history that Leeds 2023 is a year-long festival, £40 million festival of art and culture. In the same year, we've got Kirklees, which is Huddersfield and the surroundings Year of Music, followed by Wakefield Year of Culture, Calderdale Year of Culture, leading to the amazing, spectacular Bradford City of Culture 2025. So I am in a unique position in my region, 2.5 million people, to put into place social prescribing and actually be able to evidence it, because we're hoping to work with Born in Bradford, which is an amazing data gathering of young people from pre-gestation in the womb right up there now teenagers. We've got 30,000 people in that survey where we can draw on that data to prove that social prescribing works. But it isn't just about citizens' well-being or to try and end loneliness or to improve health. It's also, as a practical ex-freelancer, it's jobs. It's jobs and opportunity, and it's training. And certainly during the COVID pandemic, we know we lost so many working class creatives because they just couldn't keep going, because they didn't have a job that would take them through that difficult time. So I'm hoping that what we set up will also be a place where creatives can do dance with dementia sufferers in the day whilst gigging at night. And you know the lie of the land and how that sort of portfolio life of the creative is really important. I have come across challenges that link workers have a project that is brilliant, but they take it to a community and then they drop it onto the community. I think we can do more work about empowering our communities to create what they want from us rather than the other way around. I think it's really important that we don't expect our GPs to do everything. And I think that's where mayors and local leaders can come in. And I really like Escape to Make. They sound really exciting, young people. Really, diversion is important as a police and crime commissioner. And that's why we've got music, art, drama in our violence reduction units, in early interventions. So it's not just about social prescribing coming from health. As the mayor, I'm able to bring it in from housing, for example, housing where we make sure that there is a community centre where people can gather, or where it can come in from skills, training people in this sector. And also working with Rob I don't have, sadly, responsibility for health, but working with Rob, we've been able to find the money for an inclusivity champion that will straddle both my responsibilities and Rob and his leadership to make sure that equality, diversity and inclusivity is at the heart of that social prescribing model. So it isn't just the people who would normally come forward, but we make a real effort to identify those furthest away from help. And certainly to Caroline's point that unfortunately and sadly, male suicide is one of the biggest reasons that we lose men in our society. So Andy's Man Shed, is that what it's called, isn't it? Man Club, Andy's Man Club, that's really important here in our community. But there's loads that we're going to be doing, and I can't wait to work more closely with you. And thank you, Lord Howarth, for bringing together such a fantastic roster of leading lights in this field. And I know with your leadership, we're going to get so much done. Thank you.
There's no doubt, Tracy, at all about your commitment, your passion, your energy. Great things are already happening in West Yorkshire. There's a constellation of forces in West Yorkshire. We've got you, we've got Rob, we've got Debs. So it's not surprising. And you're going to be a beacon, I think, to all of us. But there's also a great constellation in the chat, quite remarkable. The stories that are beginning to be told in the chat, and the number of people who've introduced themselves, and the pointers towards activity that is going to be really, really important in those particular places where you find yourselves, in your spheres of influence. We will do on the Commission everything we can to make sure that policy develops in such a way that the practitioners, the leaders, the people who are really doing the work on the ground get the support, and that we do develop a systemic, cohesive strategy for creative health, articulating the values that the commissioners have articulated this afternoon, so that it is an opportunity to think about what we're all trying to do, what wellness means, what health means, how we can find better ways to help people to be well and to live fuller and better lives. Now, thank you everybody for coming. Don't forget to come, if you will, to the round tables. You know where to go for the information about that. And as Alex suggested, if anybody wants to stay on for a while, there are many questions that were in the Q&A box, and some of us have got time to address some of those questions and respond to what you have to say. But at this point, I will close this formal launch. Thank you, everybody, and I look forward hugely to working with you all.